Bismillahirrahmanirrahim. Quote of the day: Mental health is not a destination but a process. It's about how you drive, not where you are going. Assalamu alaikum. Today, the topic of my presentation is a non communicable disease, that is mental health, under kind supervision of Professor Dr. Saira Afzal. Learning outline of my today's presentation is a WHO fact sheet, introduction of mental health, international classification of disease, diagnostic and statistical manual about mental health, treatment, recent update, and at the end, there is an MCQ session. At the end of this presentation, participants will be able to describe about mental health, different classification, treatment, and recent updates. There are some key facts about mental health which are updated on 8 June 2022. 1 in every 8 people in the world live with a mental disorder. Mental disorder involves significant disturbance in thinking, emotional regulation, or behavior. There are many different types of mental disorder. Effective prevention and treatment options exist. Most people do not have access to effective care. Mental disorder may also be referred to as mental health condition. The latter is a broader term covering mental disorder, psychosocial disabilities, and mental state associated with significant distress, impairment in functioning, or risk of self-harm. This fact sheet focuses on mental disorder as described by the International Classification of Disease 11th Revision, ICD-11. This is the stat of US in which all adults having the problem of mental disorder, 19% of the population of United States suffering from the anxiety disorders, and after 19% there are 8% people suffering from the depression, and there are other prevalences of other mental disorders. In Pakistan, almost 34% of the population needs psychiatric assistance, and only 40% of those with mental illness get proper treatment. There are 6 ways to maintain a good mental health. Prefer an active lifestyle, seek professional advice, read self-help books, maintain a positive attitude, maintain healthy relationship, listen to motivational speeches. Burden of disease. Mental health conditions are 16% of the global burden of disease and injury in people aged 10 to 19 years. Half of all mental health conditions start by 14 years of age, but most cases go undetected and untreated. Depression is one of the leading causes of illness and disability among adolescents. Suicide is the 4th leading cause of death in 15 to 19 years old. Exposure to childhood trauma can cause mental health disorder and poor academic achievement. According to Diagnostic and Statistical Manual 5, a mental disorder is a psychological syndrome or pattern which is associated with distress, disability, and increased risk of death or cause a significant loss of autonomy. There are some characteristics of good mental health or a bad mental health. In a good mental health, you feel good about themselves, feel comfortable with other people, able to meet the demand of life, express emotion in healthy ways. You are always positive or optimistic, use healthy skills like stress management, decision making, and conflict resolution, uses always I messages, copes and adapt with changes, assertive, active listener, can be a part of team or a group. There are also some characteristics of poor mental health. You does not share feeling, emotions control behavior, always negative or a pessimistic, ignores and denies the problem, cannot accept change, stress control your life, You messages, blame and escalate, aggressive and passive, depressed, runs from conflict, close minded, needs to run the group. There are some myths about mental illness in our society. People with mental illness are dangerous and violent. They mentally ill cannot be trusted around children. Mental illness is caused by a personal weakness. People with mental illness are poor or less intelligent. Causes There are multiple causes of mental health. It may be inherited traits, negative life experience, traumatic, environmental exposure before birth. There are certain viruses, toxins, alcohol, or drug, and the brain chemistry in which you have hormonal imbalances. In this diagram, they shows that three factors contribute to a psychological disorder: biological influence, psychological influence, and social cultural influence. In biological influence, you have evolution, individual genes, brain structure, and a chemistry. And in a psychological influence, you must be suffer from stress, trauma, learned helplessness, mood related perception, and memories. And in a social cultural influence, roles of different people, expectations are high from the society, definition of normality and disorder. These three factors contribute, and then a person suffer from any psychological disorder. This is the Maslow hierarchy of needs. Abraham Hart Maslow was a psychologist who studied positive human qualities and lived exemplary people. In 1954, Maslow created the hierarchy of human needs and expressed his theory in his book. There are 5 steps in this Maslow hierarchy of need, and at the base there are the physiological needs, in which breathing, food, water, sex, sleep, and homeostasis and excretion. After physiological needs, the patient required a safety like home, money, and after safety there are relationship, family life, and then come the stage of self-esteem, confidence, achievement, respect others, and respect by others. And at the top of this hierarchy, there are self actualization and a person motivation to reach his or her full potential, as shown in Maslow hierarchy of need. If a person all basic needs have been achieved, then the person hopes are very much high, which is known as self actualization. There are 5 stages of grief. This model is given by a Kubler-Ross model. This model describes the process by which people deal with grief and tragedy. They apply to any form of catastrophic loss like job, income, divorce, freedom, and death. These steps do not necessarily come in order, although a person will experience at least 2 of them. There are 5 steps: denial, initial reaction to a loss, anger. Victim can no longer deny feelings. Bargaining may involve praying, alternative treatments, or promise for their better behavior. And then there is a phase of depression, period of grieving for the loss, and the acceptance, coming to the term with the situation. Now comes toward the classification. There are 2 type of classification in mental disorders. First one is International Classification of Disease. The ICD is the 11th revision of International Classification of Disease and will replace the ICD-10 as the global standard for coding health information and causes of death. The ICD is developed and annually updated by WHO. Development of ICD-11 started in 2007, and alpha version comes in May 2011 and beta draft in May 2012. A stable version of ICD-11 was released on 18 June 2018 and officially endorsed by all WHO members during the 72 World Health Assembly on 25th May 2019. There are differences between these two classification, International Classification Disease 10 and Diagnostic and Statistical Manual 5. ICD is given by the international origin and DCM is by American Psychiatric Association. There are different versions for clinical work, research and primary care. DCM have only a single version. It is available in all widely spoken languages, but DCM is available in English version only. There are single axes of ICD-10 and DCM have multi-axial. Diagnostic criteria do not include social consequences of the disorder, and diagnostic criteria usually include occupational or other areas of functioning. This is the ICD 11 classification of mental disorder, in which the sequence is organic disorder, mental and behavior disorder due to psychoactive substance use, schizophrenia, mood disorder, neurotic stress related and somatoform disorder, eating disorder, disorder of adult personality and behavior, mental retardation, disorder of psychological development, behavioral and emotional with onset occur in childhood and adolescent, and unspecified mental disorder. This is the 11th one which is added in ICD 11, unspecified mental disorder. Now comes the DCM 5, which is known as Diagnostic and Statistical Manual of Mental Disorder. Neurodevelopmental disorder, schizophrenia spectrum, bipolar and related disorder, depressive disorder, anxiety disorder, obsessive compulsive disorder, trauma and stress related disorder, dissociative disorders, substance related and addictive disorder, and the neurocognitive disorders. DCM have the 5 axes. In axis 1, they categorize the clinical disorder. In axis 2, they categorize the personality disorder. In axis 3, journal medical disorder, in which hormonal imbalance or different type of conditions fall. In axis 4, psychosocial and environmental factors are involved. And in axis 5, they globally assessing the functioning of a person by a scale which is known as Global Assessment of Functioning. This is the Global Assessment of Functioning. Axis 5 was a rating scale which is known as Global Assessment of Functioning. It is a number from 0 to 100. If you have no symptom, then you give the number 100, and 90 is for minimal symptom, 80 is for transient symptom, 70 score given to a mild symptom, 60 for the moderate symptom, and 50 score is given for the serious symptom. And the 40 given some impairment in reality testing or communication or major impairment in several areas such as work, family relation, judgment, thinking, or mood. And 30 score is for behavior is considerably influenced by delusion or hallucination, some danger of hurting self or other. Then the score 20 is given to a person, and the 10 score is given for the persistent danger of severely hurting self or others, or the persistent. Now comes the treatment. In a primary prevention, healthy personality development is key element of the primary prevention. Education and awareness of a society, youth welfare campaigns, social welfare campaign, happy family life, developing the resilience. In a primary prevention, iodine deficiency causing some mental subnormalities, vitamin B12 deficiency causing dementia, birth trauma caused the epilepsy, and pregnancy associated with postnatal depression. Pre-genetic counseling offered to a families of having mental subabnormal child already. And in the secondary prevention, you can early diagnose and a prompt treatment of the mental disorder, and mental disorders are treatable, but a multidisciplinary approach is required for the treatment of mental disorder, like the involvement of physician, therapist, dietitians, or with the help of medication. Secondary prevention strategies consist of following steps: campaign at global and national level to reduce stigma and discrimination against mentally ill persons, prevention of child abuse and domestic violence by developing school health program, suicide prevention, data collection and research at the national level are essential components for better planning. Child guidance clinic, public education and a cooperation. And in the tertiary prevention, you can reduce the duration of mental illness, minimize the disability, and rehabilitate the patient are as a useful member of the society. With the help of daycare homes, halfway homes, self-help groups, family services program, industrial therapy centers, and the vocational therapy centers. Now comes the recent updates. This is one of the article, Experience of Psychologists in the Delivery of Cognitive Behavior Therapy in a Non-Western Culture for Treatment of Substance Abuse, a qualitative study. Psychotherapy is the preferred form of treatment for psychological disorder worldwide. CBT is one of the most widely used psychotherapies due to its proven efficacy for psychological disorders, including substance abuse. Pakistan is one of the developing non-Western countries where substance use disorders are increasing at an alarming rate. Despite the proven efficacy of CBT, for substance use disorder, there is a dearth of its utilization in Pakistan. Therefore, in the present study, in-depth qualitative interviews were conducted with the CBT practitioners in Pakistan to understand the barrier and challenges in this regard. This study was a part of a broader project aimed at cultural adaptation of CBT for people with substance use disorder in Pakistan. In order to utilize the benefit of CBT for substance use disorder in Pakistan, cultural adaptation is necessary as an initial step. However, its delivery requires stringent modification in the healthcare system to address these challenges. There are a dilemma of psychiatric care in Pakistan due to stigma, shortage of mental health professionals, insufficient psychiatric beds, brain drain, inadequate psychiatric services in periphery, no structured training programs for GPs. But there are change in the scenario due to the Mental Health Act 2001, activities of mental health NGOs, recognition of mental health in general healthcare, and the international collaboration. There are some suggestions for the improvement in the field of psychiatry: psychiatric faculty development in teaching hospitals, post of consultant psychiatrist in Tehsil and district, implementation of Mental Health Act, public awareness program addressing mental health issues, and the structured training of GPs in a collaboration with Academy of Family Physician, Pakistan Psychiatric Society, WPA section on education, and Pakistan Medical and Dental Council. What is the World Health Organization response regarding mental health? WHO Comprehensive Mental Health Action Plan 2013-2030 recognized the essential role of mental health in achieving health for all people. This plan includes 4 major objectives: to strengthen effective leadership and governance for mental health, to provide comprehensive, integrated, and responsive mental health and social care services in community-based setting, to implement of strategies for promotion and prevention in mental health, to strengthen information system, evidence, and research for mental health. WHO Mental Health Gap Action Program use evidence-based technical guidance, tool and training packages to expand services in country, especially in resource-poor setting. It focused on prioritized set of condition, directing capacity building towards non-specialized healthcare providers in an integrated approach that promotes mental health at all level of care. The WHO Mental Health Gap Action Program Intervention Guide 2.0 is a part of this program and provide guidance for doctors, nurses, and other health workers in non-specialist health setting on assessment and management of mental disorder. Now comes the MCQ session. A 45-year-old person motivation reach to his or her full potential according to Maslow hierarchy of need, in which level this is fall. Physiology, self-esteem, self-actualization, safety, or a resilience.
Self-actualization, C.
C, self-actualization is correct answer. The ability to recover from painful experience and difficult event is not an unusual quality of a person and it can develop in everyone. Which type of quality is this? Development of resilience, development of self-esteem, development of self-actualization, development of delay.
C.
Yes, C is the right answer. 30-year-old boy was admitted in rehabilitation center due to use of substance, but he cannot accept the treatment. According to stages of grief, in which stage he is fall? Denial.
Alpha.
Alpha is the right answer. Yes, A is the right answer, denial phase. In rehabilitation center, 30-year-old boy having no longer in the phase of denial. Which type of phase now he is facing? Anger, depression, denial, bargaining, or acceptance?
D. Bargaining.
Delta.
After denial, he facing the phase of anger. A is the right answer. Mentally healthy person having all facilities like eating food, breathing, sleep, and proper home for routine activity. Which level of hierarchy this category fall? Physiology, self-esteem, love and belonging, safety, self-actualization.
Alpha.
Yes, alpha.
Delta.
Right answer. A is the right answer. There are 5 axes according to Diagnostic and Statistical Manual 5. If any person feel financial burden and facing the problem of disturbed family life, according to DCM-5, which axis is this? Axis 1, 2, 3, 4, or 5?
Axis 3. C.
Axis 4, D is the right option. In axis 3, there are hormonal problem, medical condition. There is genetic predisposition of psychiatric distress in Mr. Ali family and genetic counseling is very much important. Which type of influence is this in psychiatric disorder? Biological influence, social influence, environmental influence, personality influence, or a cultural influence?
Biological influence. Alpha.
Alpha, biological influence is right answer because genetic involvement is involved in the psychiatric disorder. According to DCM-5 in Axis 5, there is a global assessment of functioning. 40-year-old male shows the mild symptom. The score of this person according to global assessment of functioning falls in 80, 70, 60, 50 or 40. Mild symptom. The right answer is B, 70. 70 is for mild symptom. ICD-10 is converted into ICD-11. Which one type of disorder is added in this category? bipolar disorder, unspecified mental disorder, eating disorder, substance abuse, or a personality disorder.
Beta.
Beta, unspecified mental disorder, is added in the ICD-11. A 16-year-old year-old boy was previously good student, suddenly becomes withdrawn from friends and family. He is also stealing money from his mother. He is also except using drug during history taking, the most important factor that will help in stopping the drug abuse, provision of medical treatment, self-motivation, cognitive behavior therapy, detoxification, and a use of sedative drugs.
Beta.
CBT, psychotherapy. C is the right answer. This is the key of my MCQs. YouTube link of the presentation, and thank you.
Thank you very much, Dr. Naila. Very nice presentation, and especially your graphics that were outclass, and very important information has been given, especially about cognitive behavioral therapy and how it has been used for decreasing the incidence of the mental health problems and psychological stress, the substance abuse, and all the important information that you have covered. The most important point I must re-emphasize is about DSM-4 classification. And we know that generalized anxiety disorder, depression, juvenile delinquency is one of the very important components of the curricula of the postgraduate programs that are in the Department of Community Medicine. So I would like everyone to have more information about DSM-4 criteria. Thank you very much. Very well done, Dr. Naila. And I really feel so proud that you have presented so well. Allah Hafiz.
Thank you,
Love
ma'am.
this, ma'am.
Khuda Hafiz.
Thank you.